too many American hospitals are sick. I'm Lloyd Dobbins. Hospitals cause death, error, waste, expense. They cause misery and dissatisfaction for their patients and employees. You probably already knew that. But what you don't know is all of that can be fixed. It won't be easy and it won't be quick, but all the things wrong with hospitals can be fixed. If we do fix hospitals, their cost will go down, not up, which makes this that rarest of television programs, a good news documentary.
Well, I went down to the St. James Infirmary just to see my baby there.
Americans are accustomed to getting everyday miracles out of the healthcare system, keep us alive and well past what our parents could have ever imagined, or our grandparents ever imagined. But the system that delivers those miracles is also rife with waste and inefficiency to an extent that I think very few Americans appreciate. 100,000 people perhaps dying each year of in-hospital infections that could have been prevented. 100,000 medication errors in hospitals each year that kill people.
We're going to show you two hospital groups that are improving, that are healing themselves. One is in Pittsburgh, the other is headquartered in St. Louis. Their treatment does not involve insurance and does not involve the government. It does involve recognition that hospitals are more complex than they used to be.
Complexity has increased both in technology, medications available, treatments, payment mechanisms.
The emergency room could do of themselves. It turned out to be an entire hospital activity. That's the greatest example that I can think of for systems thinking.
Sister Mary Jean Ryan heads SSM and uses systems thinking to make improvements. We'll get to it later, but remember the words systems thinking.
If you try and do it just in the emergency department, it'll fail. You have to have the support of housekeeping to get the room clean so you can get the patient out of the bed here and admitted to the hospital. You have to have the commitment of administration. It has to be a whole institution-wide initiative.
This was going to require a systemic change of our whole organization and a totally different culture.
And I think what systems thinking says is that you can't do one thing in isolation without knowing that it's going to impact all other things.
I said we would get back to systems thinking, and here we are. Systems thinking can be complex, but in this instance it is not. It is basically how you see things. Instead of seeing one huge mess with one problem piled on top of another, you see differently. You see with what people call new eyes. You see how you and your work fit into the system and how you and your work connect to the other people in the system.
In a complex environment like healthcare, everybody doing their very best obviously is not good enough. We have to have a systems approach to be able to tie all this together.
We are really now beginning to understand that we have archaic processes in our hospitals that for the most part set up our clinicians in an atmosphere that allows them to make errors. It's because the processes that we have either stress our nurses, don't allow physician interactions correctly, but the problems that we have are not mostly the individual, and it's more the system.
To solve the problems in the system, you have to see the system as you have never seen it before. It is crucial that you see it with new eyes. You have to see the processes working together. You have to see the whole hospital system. You have to see how blaming people does not help. You have to see how to practice continual improvement, and you can learn how to see all of that. That's part of what American experts taught to Japanese industries to save a bankrupt economy after World War II, and it worked.
It mobilizes a team to attack the chronic waste, and in this case, successful.
Using what Toyota Automotive has learned about quality could be the best medicine our hospitals can get.
What do you mean? Toyota Productions is going to come to Shadyside Hospital. But when you start tearing apart the principles that they have and how they do get to the root of a problem and find problems and fix it so that it's never broken again, it's amazing.
Toyota is really about designing work, doing the work. How do we understand work? How do we improve work? So it's not just about cars, it's about how we do our work.
The methods we have shown you are known, tested, and proven. They do not require more staff or expensive consultants. They do not require the health insurance industry or the federal government to do anything. Improvements can be made starting today in every hospital in the country. Costs will come down. So the question now becomes, can we afford not to heal our hospitals? We can, if we want, not do anything. But if we decide not to do anything, we have to accept that every day, 500 people will die in hospitals in the United States who did not have to. You and I might be among them. Costs will come down. About $1.7 million saved with fewer deaths as coronary bypass readmission declines 4.7%. 85% reduction in hospital-acquired infections, infections that are often fatal and cost $30,000 to $90,000 each. A 63% reduction in central line infections since 2001, half are fatal, and each cost $30,000 or more to treat. Staph infections were reduced from 26 per thousand to 8 per thousand.